Hello and welcome back to our channel where we dive deep into health and wellness topic. My name is Preventive and today we are going to be discussing a very important topic, which is regular checkups and tests for women from age 20 and above. Before I continue, I want to remind you to subscribe to this channel and don't forget to hit the notification bell for more valuable discussions. So let's dive right into the topic. I'm going to be discussing each of these tests in details, so grab a seat. Number one, I'm going to be talking about pelvic examination. You need to get a pelvic examination test. A pelvic examination is a routine examination for women's reproductive organs, including your uterus, your ovaries, your fallopian tube, and your cervix. It's typically recommended every 1 to 3 years. Although the frequency may vary based on individual health factors and medical history. So we are going to be talking about is pap smear. Pap smear or pap test is usually a screening procedure used to detect abnormal cells in the cervix that can potentially develop into a cervical cancer. So this test starts from the age of 21. Women are advised to get a regular pap smear test, usually every 3 years, combined with a HPV test. Now, this test involves collecting cells from your cervix during pelvic examination, and these cells are then examined for any abnormality. Usually check if there is any abnormality in the cervix. Number 3 I'm going to be talking about is the breast examination, breast exam and management. Now, self-breast examination are very vital, and it is encouraged for women to be familiar with their normal texture and the appearance of the way their breast is. If you notice any changes, you should quickly report to your doctor. And mammogram x-ray image of your breast is typically recommended around the age of 40, and it should be done depending on the individual risk factor. Maybe let's say you have a history of a parent who suffered a breast cancer. It is encouraged that you get this examination done. This to help detect any breast cancer cell early, so that your treatment will start quickly and it will be more effective. Now, number 4 we are going to be talking about is cholesterol test. Now, a cholesterol test is known as a lipid panel, and it measures the level of your cholesterol level in your blood. It's crucial for ascertaining your heart health, and is usually recommended every 4 to 6 years, especially for adults. However, it is more frequent. You're advised to do this test frequently if you have a history of diabetic or obesity or a family history of heart diseases. You're advised to do this test frequently. Now, the number 5 tests I'm going to be talking about that is necessary for women aged 20 and above is the blood pressure check. Checking your blood pressure is very important. Regularly monitoring your blood pressure is very vital for your overall cardiovascular health. High blood pressure, if left untreated, can lead to serious health issues like heart disease and stroke. So it is very important that you get yourself checked on time. Now, sixthly, we are going to be talking about bone density tests. This test measures the bone mineral density, and is often recommended for women around menopause or those at higher risk of getting osteoporosis. These results help ascertain your bone health and the risk of fracture. Your lifestyle changes and medication can be recommended based on the findings of these tests. Now, if you have any history of a parent that had this issue, it's very important that you do the test on time. So if it is detected, you can start treatment. Exercise is also very important for your bone health. Number 7, I'm going to be talking about sexually transmitted infection testing, STI testing. Depending on your sexual activity and your risk factor, it's very important you test for STI, especially HIV, gonorrhea, chlamydia, and other necessary STI testing. Now, Regular STI testing is very crucial for early detection and treatment to help reduce your risk of complication and preventing the spread of this infection. The eighth test I'm going to be talking about is blood sugar test. Very, very important. Regular check for diabetes risks may start around age of 45, especially if there are any risk factors such as obesity, family history of diabetes, and if there is a sign of insulin resistance. Please make sure you get your blood sugar test regularly. Now, this test measures your blood glucose level and help in the early identification and management of diabetes. Now we are going to be talking about monthly and yearly checkups. I'm going to be dividing them into the test you're supposed to be doing monthly and the test you're supposed to be doing yearly. Now, for the monthly test, for one is self breast examination. Self breast examination is very important to perform a monthly breast examination to detect any changes or any abnormality in your breast. This is why it is very important for you to know what your breast look like, or how the texture of your breast is, so you can be able to detect when something is abnormal. Second test for you to check as a woman is your skin. Do a skin check. Yes, monitor moles and skin changes for any sign of a skin cancer. People don't really take this skin check very serious, but it is very important. Get your skin check. The sun over here is hot and it can affect the way we can get skin cancer, even the cream we use. So it is very important that you get your skin check. Number 3 is menstrual cycle tracking. Keep track of your menstrual cycle. It is not really a test, but it is very important. Keep track of your menstrual cycle so you can get to do any irregularity or any changes, to be able to detect it on time. There are women that don't even keep record of their menstrual cycle, and that is very, very wrong. You need to know when there is a change in your menstrual cycle length and know when there is a problem. I'm going to talk about yearly examinations that you're supposed to do as a woman. Number 1 is your annual gynecological exam. This involves your pelvic examination and also involves pap smear. Pap smear, you can do it yearly depending on your health history. Secondly is your blood pressure check. Regular monitoring help identify and manage hypertension. So you might not necessarily do it every year. Blood pressure can be checked anytime. Secondly is cholesterol test. A fasting lipoprotein profile is typically done every 4 to 6 years, but more frequently if you have a high risk factor. Now remember, I'm discussing yearly tests that you should do, but if you have a high risk, let's say you have a medical history where your parents or someone in your family had this issue, it is very important that you do a test even before 1 year. Now, thirdly is your dental checkup. Visit the dentist for a regular cleaning and checkup at least once a year. At least once a year. It is very, very important. Fourthly, I'm going to be talking about your eye examination. An annual eye examination helps detect any visual changes and any eye condition. You don't need to wait till you have an eye issue. This eye is very, very important. So get an eye check every year, at least every year. Now there is something called a general health check, a comprehensive physical examination, and this helps to identify any potential health issue. So it is very, very advisable when you go to a laboratory, just tell them you want to get a general health test. They will run every test that they need to run on you. So it is also very important. Now vaccination, you need to stay up to date on vaccination, including flu shots and other recommended immunization that is required for adults. Now, mammogram is very important depending on your age and your risk factor. Mammogram are recommended annually. Mammogram is very, very important. It is recommended, especially if you have a family history. I'm going to be talking about let's say you don't have the money to do all these tests that I have mentioned. There are 2 important tests you should do as a woman. One is hormonal profile test. This is very important. It provides valuable information about the level of various hormones in your body. You know, hormones are chemical messengers that play very vital role in the body. Our hormones such as estrogen and progesterone play a very central role in the menstrual cycle, fertility, and overall reproductive health of a woman. A hormonal profile test is going to help to ascertain and know the balance of these hormones. It's also going to help to identify any irregularity that may affect your fertility or your menstrual regularity. Now, hormonal imbalance can lead to irregular menstruation, irregular menstrual cycle, heavy and prolonged period, or even absence of period. A hormonal profile test is going to help in identifying specific hormones involved, and also going to help in targeting your treatment. For women trying to conceive, a hormonal profile can provide insights into your ovulation, your ovulatory function, the health of your reproductive organ, and potential factors affecting your fertility. Now, women undergoing hormonal replacement therapy, such as during menopause, may require a regular hormonal profile test. This to ensure that your hormonal levels are within the desired therapeutic range. I believe that most of us know what PCOS is. PCOS is a common hormonal disorder affecting women of reproductive age. Now, a hormonal profile test is going to help diagnose PCOS by evaluating your the levels of your androgen. Androgen is a male hormone, but is also found in women. And it's also going to ascertain other hormonal imbalances associated with this PCOS condition. So the earlier you get the hormonal profile test, the better for you. Now, this hormonal profile test is going to also help to detect your thyroid hormone. The thyroid hormone plays a crucial role in the metabolism and energy regulation. Hormonal profile test is going to identify any thyroid disorder, such as hypothyroidism or hyperthyroidism, which can impact your overall health and your fertility. Hormones like estrogen are vital for maintaining bone density, so a hormonal profile test can also ascertain the condition like osteoporosis or blood or bone loss. It's going to examine the health of your bone, so it is very, very important. Now, during menopause, hormonal level, particularly the estrogen, the progesterone decline, they tend to reduce. A hormonal profile test can help in detecting any decrease, and a hormonal profile test can also help in managing menopausal symptoms, and is going to ascertain the need of any hormonal replacement in case you want to do a hormone replacement therapy. Regular hormonal profile testing, especially in your specific life stages, or when you're experiencing a lot of symptoms like hormonal fluctuation, hormonal profile test is going to help detect this fluctuation. It's going to tell the hormone that is fluctuating the level of each hormone. So this is why it is very, very important. Even if you don't want to do all the tests I've mentioned, make sure you do a hormonal profile test. And secondly, do a mammogram. Mammogram is very important for you, especially if you have any history of a relative or a parent who had a breast cancer. Mammogram is going to help you detect these cells earlier before you even develop these cancerous cells. Any cell that is abnormal, and then you can commence treatment before it develops. Now, I forgot to mention liver function test. Liver function test is very important. Liver function tests are a group of blood tests that provide a valuable information about the health and function of your liver. I believe that you know that the liver is a very vital organ. The liver is responsible for numerous functions of the body. The liver helps to test and identify any liver disease or any disorder such as hepatitis and any fatty liver disease. So it is very important that you do a liver test. I cannot overemphasize on how important a liver test is. Kidney function test too is very important. Kidney function test is a group of blood and urine tests that provide information about the health and function of your kidney. You know, the kidney plays a very important role in helping to filter out waste products and excess fluid from the blood. Kidney function test is very important, especially if you've noticed that you're always on medication, you're always taking drugs, you're always popping pills or herbal medication. Please take a kidney function test to know if your kidney is still healthy, so you can know how to target your treatments on time to avoid any health challenges in future. If you found this video helpful, please don't forget to like, don't forget to share, and don't forget to subscribe to this channel. I'm going to be bringing you more interesting topic on feminine health. Thank you so much for watching. Till next time, bye.